Hello everyone, this is Dr. Shishma Sarila, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about PCOD versus PCOS part 2. In part 1, we have already discussed what are the medical differences that we see, what are the cyst differences that we see in PCOD and PCOS, what is the pathological outline difference between PCOD and PCOS, and who develop PCOD and PCOS. So today, if we are going to review the symptomatology, how different the symptoms of PCOD and how different are the symptoms of PCOS, and if you're someone who's suffering from irregular periods or painful periods, that is dysmenorrhea, you can evaluate the symptoms while watching this video and you can see what you're suffering from. So let's dive into the topic to know more about them. So now let us have a little recap of what we have done in part 1. As you know, PCOD refers to polycystic ovarian disease. So disease is something that is very particular to a certain organ, right? And here in PCOD, we have immature follicles which are formed into smaller cysts. And the number of cysts and the size of the cysts in PCOD is very less compared to PCOS. So what is PCOS? PCOS is polycystic ovarian syndrome. When we are mentioning the word syndrome, it means that it affects more than one organ. Here, many organs are affected in PCOS and we will get to know about them in detail as we go further in the video. So PCOD, the main purpose or the main pathology runs where the hormones are disrupted. It is mild in nature, the hormones are disrupted, and the hormones are estrogen and progesterone. Whereas if you see PCOS, there is hormonal disruption. Along with that, there is excess of androgen, that is testosterone, in the female body. If you see about the hormones, the main difference is in the PCOD there is estrogen progesterone difference or imbalance. As we can say here in PCOS, there's a lot of difference, like luteinizing hormone is more, the FSH is less, the progesterone is less, the estrogen can be divided into E1 and E2. E2 is less, E1 is more, and then we have this prolactin. Some people we have hyperprolactinemia. So it's hard to remember. So how do you differentiate? This has a lot of estrogen and progesterone difference, whereas PCOD has a lot of androgen hormone, that is testosterone is increased. That is the basic difference that you can differentiate between PCOS and PCOD. If you're someone who doesn't know if you're suffering from PCOS or PCOD, even after seeing this complete video, just get an androgen test done and check your serum level. If it is more in nature, then you can finalize it as PCOS. Then coming to the menstrual cycle differences between PCOD and PCOS. In PCOD, you will understand that the menses are irregular or they can be delayed. Many patients come to us complaining we have irregular periods, and when we ask in detail, remember that the homeopathic case taking is very different from allopathic or conventional form of case taking, right? So in homeopathy, we give attention to every detail that you're mentioning it to us. So if you're someone who's saying like I have irregular periods, we will ask you when was your last period, and then how is your cycle, is it irregular or is it late? There is a vast difference between having an irregular period and having a late period, right? So what is the difference? For example, if you're someone who's suffering from periods which are delayed, like your cycle is 45 days, sometimes your cycle is 50 days, sometimes your cycle is 60 days, but you see the pattern repeating, that is every 60 days or 60 to 65 days or every 40 to 45 days, every 30 to 35 days, you're having the period regularly. Although it is late, you're having it at a regular period. So that is called periodically late period, which is a characteristic of PCOD. And in PCOS, if we see, we have irregular period. What do you mean by irregular period? Sometimes your period cycle is 10 days. And sometimes many people feel that if they have PCOS, they will not be having proper bleeding, or the bleeding will be very scanty. Remember, PCOS presents in different manners. We had a patient who walked into our clinic, and she was complaining about periods, that is menstruation, frequently for every 10 days it is being repeated. So what would you guess as a doctor? It should be either bulky uterus, or she should be having fibroids or endometriosis. You should be guessing all of these stuff, right? But when we got a scan done, it was PCOD and there is no bulky uterus, endometrial thickness is good, and even there are no fibroids also. See, PCOS presents itself in different manner. But the cycle period, if you see in PCOD, the cycle period usually, although late, it is a little bit regular in nature, even if it is late. If you take PCOS, it is very irregular. Sometimes you'll be having period cycle for 10 days and then you'll start your menstruation, and then after 1 or 2 months you'll get your period, and then again after 10 days you might be getting your period, or 20 days, or 6 months, or sometimes there is no period at all for 6 to 8 months. That is a period of secondary amenorrhea. That is what we call in medical language. That is, you're not getting your period for a period of 6 to 8 months. Also, there is no sign of your period, and then it suddenly appears. So there is no regularity in that. That is called as an irregular period. So that is characteristic of PCOS, right? So PCOD, although it is late, it can be a little bit regular, but PCOS is very, very irregular in nature. Now let us see how PCOD and PCOS impact the fertility rate in women. If you take PCOD, it rarely causes infertility. The reason why PCOD rarely causes infertility is the egg is released in PCOD, but the thing is that, and it is also reversible in nature. If you come or take a doctor consultation as soon as you diagnose with PCOD, then it will be easy to reverse the condition. That is one thing. Second thing, the reason for the rare cases of infertility also because the patients who are trying for babies do not know their ovulation date. Some people, even though they are suffering from PCOD, they might have irregular periods. Okay, not late but irregular also, irregular and delayed, or irregular and too early also. So whenever we are having this irregularity in the period, we do not know what is the proper day of the ovum which will be released. Okay, so that is why they can have this infertility issues. Okay, so PCOD is treatable, it can be reversed. Infertility is very rare in PCOD. Whereas if you see PCOS, the problem with PCOS patients is not only the irregular period, but is the main problem is anovulatory cycle. What do you mean by anovulatory cycle? What are the causes for this anovulatory cycle? We have already done a video on that which goes by the name PCOD versus PCOS. You can check. We will be providing the link in the description box. So what do you mean by anovulatory? That means there is no egg releasing out of the follicle. So if there is no egg, what is the use of even having a sperm, right? So there is no fertilization and they cannot conceive. The problem with PCOS is the anovulatory cycle. So PCOS does affect the fertility, it decreases the fertility rate. It is very rare that people with PCOS conceive, and even if they do conceive, many people, hardly make it to good delivery. Many people do suffer from miscarriages and abortions either in the first, second or the third month. So if you're someone who's suffering from PCOS, try to take homeopathic medications on time and get your disease diagnosed fast, so that ongoing if you continue with the homeopathic medications, your fertility rate can be increased and also your chances of getting pregnant can be increased. Now let us see how weight does impact or how PCOS and PCOD will impact the weight in your body. If you take PCOD, yes, it does come with a heavy baggage, that is, it causes or it is occurring in people who are obese, first thing, and also PCOD does cause you, or the hormonal changes in that occur in PCOD will make you fat or will make you obese. Okay, it's a cycle that causes this, and this in turn maintains that obesity, right? So but you have to remember that after taking good homeopathic medication, if you're making lifestyle changes, sleeping properly, eating good food, then PCOD can be reversed, and even the weight that you're put on due to PCOD can be cut down very easily. That is, people with PCOD will be able to lose their weight very easily. But that's not the case in PCOS. People who are suffering from PCOS, it is very hard for them to lose weight. See, even if you're putting them under high keto meal, or if they are putting it under no carb meal, if they are putting it under carnivore meat diet plan, anything that you're putting PCOS patients under, they will be very hard for them to lose weight, right? So what is the best method or what is the best diet plan for them to follow so that they can lose the weight in PCOS is by taking anti-inflammatory foods, or by taking a diet which is anti-inflammatory in nature. So PCOS people will find it very, very hard for them to lose weight. So if you do want to lose weight, try following an anti-inflammatory diet. Next, coming into the metabolic impact that these diseases have on the body. Primarily going to PCOS, it has very minimal impact because it doesn't alter a lot of hormones like thyroid, it can be insulin. It doesn't harm or alter thyroid or insulin that much, or GnRH that much. But if you take PCOS, it has really bad metabolic impact. That is, this fluctuation in your LH, FSH, progesterone, estrogen, increase in E1 causing estrogen dominance in some people, and high pulsations of GnRH, all of this can cause, they come with baggage which is insulin resistance, they come with type 2 diabetes, they come with high cholesterol, that is hyperlipidemia, they come with a baggage of, they have a risk of developing heart diseases much more, and also they have a risk of developing endometrial cancer. And since we're talking about metabolism, you have to remember that many of them do present with hypothyroidism. So whenever you're having hypothyroidism, what happens? Your metabolism is slowed down, right? So whenever you have slow metabolism, the whatever you eat is converted into fat. So that is why they have a hard time losing weight, especially PCOS patients. And not only that, your blood cholesterol level is also increased. That is, they have a decrease in HDL, which is good cholesterol, or we can say good lipid, and they have an increase in the bad lipids. That is VLDL, LDL, as well as your triglycerides. VLDL means very low density lipoproteins. LDLs are low density lipoproteins, and then we have cholesterol, we have triglycerides. There is an increase in lipid, that is dyslipidemia is seen, and also arthrogenic index is also increased in PCOS patients. So the metabolism is decreased, and other things, that is whatever that hamper the metabolism, are increased. Now coming to the health complications in PCOS and PCOD. If you take health complications in PCOD, I've told you that it doesn't do a lot of harm unless it is very chronic in nature. Remember, PCOD is also harmful, but you have to understand that it should be chronic in nature, and in people who have a genetic history, and in people who have really bad lifestyle, that is improper sleep, a lot of stress, can go into really bad state of PCOD also. So that is also a risk factor. But in starting stages of PCOD, it doesn't do a lot of, it doesn't affect your body too much, so as for you to have other symptoms for the organs. If you take PCOS, it's serious in nature. It hampers your insulin. It plays with your insulin. It plays with your thyroid, leading to hypothyroidism, type 2 diabetes, which come after the insulin resistance, high cortisol level, and then you might be having dyslipidemia, you might be having high androgenetic index, and you might be having, you can be prone to high BP, that is high blood pressure, and also that is hypertension. And then you can also be exposed, or you can also be prone to endometrial cancer as well. So PCOS comes with a lot of baggage. So if you're someone who's suffering from PCOS, you don't have to worry that you will be getting all of these diseases. It depends upon your genetic makeup and your lifestyle also. So make sure, if you are a PCOS patient, to contact doctor as soon as possible. And then we have emotional impact. How does PCOD and PCOS play with the emotion? In PCOD, many people don't even experience them. Some people do experience them. It doesn't mean that if you're having mood swings, that you're having PCOD. It doesn't mean like that. Some people do have a lot of fluctuations naturally also. So even though if you're suffering from mood swings just before your period or during your ovulation, doesn't mean you have PCOD. It just is that it's a coincidence, or you can say that's a common factor between PCOD and normal people also. They will experience certain mood swings, especially 1 week before periods, but the mood swings are not too much that they can't handle. Whereas in PCOS people are more prone to anxiety disorders, or panic attacks, or depression. Even if you're seeing a small Instagram reel which is sad, or which causes you to get this weeping kind of tendency, it triggers that weeping tendency. All of that is present in PCOS. Suffering from PCOS also have this depression alongside anxiety also, because they have hard time losing weight. They try different things, they don't lose weight, they get frustrated, the skin starts to become dull, the acne starts popping out, skin becomes very oily, hair starts falling down. So all of these are associated, and especially women are very concerned about how we look, right? So that will be affected. They are more prone for anxiety and depression rather than PCOD people. PCOD people might experience mood swings, but they experience clinical symptoms of anxiety and panic attacks. Now coming to reversibility, we'll see how PCOD and PCOS, if they can be reversed or not. PCOD is completely can be reversed. It is reversible in nature. If you're taking good medications, following diet, doing your workouts regularly, you can reverse it in 6 to 7 months. But it also does depend upon the cyst size and the number of cysts. Usually it is completely reversible. You don't have to worry a lot if you're someone who's experiencing PCOD symptoms. But people who are experiencing PCOS should be a little bit careful, because they need long time treatment, they need long time medication, they need medication for diabetes, they need medication for thyroid, they need medication for hormonal fluctuations, they need medication for ovulation, they need medication for this mood swings, they need medications for their skin improvement, they need medications for their hair fall. So there's a lot of things attached to PCOS. So it under proper conditions, given the timeline or time frame, it can be highly manageable if you're following certain instructions. Okay, and in some people, who follow the combination of homeopathy, diet and workout, it can, you can manage the symptoms, the cyst size can decrease, and on a longer run you will be completely healthy. Now coming to the long-term risk in PCOD and PCOS, PCOD doesn't present with a significant risk, whereas PCOS can present with diabetes, cancers, or heart diseases also. Coming to the severity, PCOD is less severe compared to PCOS because PCOS, it is a syndrome, right? So it has a lot of other organs which are affected by this PCOS. So it is more severe compared to PCOD. Now coming to the conventional form of treatment for PCOD and PCOS. Remember that conventional form of treatment or allopathic form of treatment have a basic plan for PCOD or PCOS, that the common thing is hormonal contraceptives. So what is the problem with hormonal contraceptives if you are intending to treat the patient? The behind scenario of why they give you hormonal pills is that there is decrease in progesterone level, which will hamper the GnRH pulsation. So they give you these synthetic hormones, the GnRH can be managed so as to manage the PCOS. But the problem with hormonal contraceptives is if you're a teenager, or if you're someone who is in your late 20s and you want to get married, or your early 20s and you want to get married and you want to have babies, so contraception is not the best way to choose. Second thing, they have their own side effects, that is, apart from you gaining weight because of this PCOS and PCOD, some people do gain extra weight or put on few extra pounds after using this hormonal treatment, and also the skin becomes a little bit more oily, you can be acne prone, your hair can start to fall, and your mood swings will be extreme after using this hormonal pills. And although it is intended for good, that is to decrease the symptoms, in some people because of the synthetic hormones it can trigger other symptoms, and also the PCOD can go worse. And apart from that, after you stop using these hormonal contraceptives, again the symptoms will reoccur if you're someone who's suffering from PCOS, and also even if you're someone suffering from PCOD. And the recurrency rate is also much higher in people who are using this oral contraceptive. Apart from that, there is people who are using IUCDs. This is the same one, it is taken through the mouth, the other the device is inserted in the uterus, but that cannot be done in people who are not married, and also that cannot be done in people who are having other symptoms like other clinical symptoms of other diseases. Okay, and IUCDs you cannot conceive because that is a contraceptive measure. So that is the problem with IUCD, and also if it is misplaced then it can cause perforation, that is hole in the uterus. And then we have finished the PCOD treatment, and the PCOS comes with other things, right? That is sugar, that is type 2 diabetes, it comes with anovulatory cycles, it comes with hyperandrogenism. So in order to maintain that, they will be giving you metformin, which is for type 2 diabetes. But remember, metformin does have side effects, like it can decrease the muscle strength, and also it can decrease the muscle in the body. That is why people who have type 2 diabetes, suddenly, even if they are like this obese, suddenly they becomes very thin after having this metformin, is because they lose their weight, they lose their water weight, and they lose the muscle also. And they give anti-androgen medications so as to maintain your androgen level, and then as soon as you stop these medications you will again be having a recurrence of that. And then you have ovulation inducers so that you get your egg to be released. As soon as you stop using these medications, they can again be recurrences. So we have seen the reason why we are using this conventional form of treatment. But remember, conventional form of treatment doesn't give you a complete cure for PCOD or for PCOS. But there is a type of medication which does give, which is nothing but homeopathic form of treatment. So why does homeopathic form of treatment, or how is homeopathic form of treatment much better than conventional form of treatment? Because conventional form of treatment, it comes with a baggage or with their own medicational risks. Here you do not have those risks. It's completely safe and completely effective. And then you have to visit a lot of doctors if you are going or opting for allopathy, because you have to visit a gynecologist, you have to visit a trichologist for your hair fall, you have to visit a dermatologist, you have to visit a psychologist for your mood swings and for your depression and anxiety. But in homeopathy, the doctor who is taking the case will analyze your emotional problem as well as your physical problem, and why you have started developing this disease, so they can understand the chain of events that are happening in your life. So no allopathy doctor will ask you like, is there some sort of problem in your personal life, that is from when this PCOS or PCOD has started. They usually ask your symptoms and then give you medications, right? That is their form of treatment. There is no backlash on that. But in homeopathic form of treatment, we do ask you because it is necessary for us to treat you holistically. So we will not be giving you different medications for different diseases. Because you're a whole same person who's suffering from the diseases, we will give you medication that will work on your pancreas, it will give you medication that will work on your hormones and on your ovaries, it will work on your hair fall, it will work on your skin, it will work on your acne, it will work on overall improvement, and it gives you better fertility rate without any side effects. And you can keep trying for babies even after or even while using homeopathic treatment. Remember that if you stop this taking this hormonal pills for a week or for 4 or 5 days in between, you can experience intermenstrual bleeding. But that doesn't happen in homeopathy, although you have to take it regularly. By skipping 1 or 2 days by mistake, if you're skipping these 2 days, you might not experience these symptoms as you're experiencing in allopathy. So it's completely safe, it's effective, it's better for health, it evaluates the cause, it's holistic in nature, it understands the link, it balances your hormones, it helps in giving you better health. And also the recurrence rate of homeopathy is very less. That is, after being treated by a homeopathic doctor for your PCOS or PCOD, it is very unlikely that you will be developing another episode of it. So homeopathic form of treatment is complete in nature, and the recurrence rate compared to allopathy is very low, and it will relieve your current symptoms, cure your disease, and prevent furthermore recurrence. If you're someone who's suffering from PCOD or PCOS, you have to remember that sleep is very essential. 10 to 1 o'clock is called as hormonal repairing time. If you're someone who's suffering from these two diseases, or if you're someone who's watching this for educational purposes, do understand that sleeping before 10 o'clock or sleeping at 9:30, getting up at 5:36 is the best way to cure majority of your lifestyle diseases, including type 2 diabetes. So try sleeping during that time. And then coming to the lifestyle changes, improve your diet, that is, increase fiber in your diet, increase protein in your diet, decrease carbs and consume complex carbohydrates, and also increase nuts and seeds in your diet, and good amount of healthy fats and not bad fats. Avoid unnecessary biscuits, or it can be chocolates, or anything that is processed and packed. Try checking your vitamin D once, because prolonged period of low vitamin D or low amount of vitamin D in your blood, we have seen a pattern in our patients where PCOS PCOD patients do always have this vitamin deficiency for a longer period of time. So please do check your vitamin D levels and see if you are suffering from it, and do take certain supplementations that will fulfill the vitamin D deficiency, and get good amount of sun exposure. And then working out is very, very important. If you're someone who's suffering from PCOD or PCOS and has painful periods, remember, do 2 days of cardio workout, not too much of cardio, that is not too much of jumping and running. Try doing cardio which is of high intensity, but it should not include anything which has jumping in it. And then include 4 days of muscle building and stretching exercises. It can help you in building better muscle, and a lot of muscle means less amount of glucose spikes, and also your hormones are much balanced after workout. So try doing these. So what happens if you neglect PCOD or PCOS? Remember, PCOD on a chronic run can affect your body, and it can cause insulin resistance, hormonal dysfunction, and irregular periods, and it can cause infertility. So do not neglect PCOD. But PCOS, on the starting day, from the moment you are experiencing these PCOS symptoms, it is dangerous in nature. It's a syndrome which affects major organs in your body. So it causes hormonal disruption of major organs in your body, like thyroid, it can be insulin, it can be a GnRH. So remember to not take PCOS lightly, or even PCOD lightly. If you're someone who's experiencing delayed periods or irregular periods, do take doctor consultation as soon as possible, so that it can be easy for the doctors to treat you while it is in the starting stage. And after it's all messed up, it will be very hard for the doctor, and also for the patient and the family members, to experience symptoms, and also for the doctor to treat it. So do not neglect your PCOD or PCOS symptoms. Coming to the consultation options, here we have seen why homeopathy is important. How we have seen homeopathy is much better than allopathic form of treatment, and in homeopathic form of treatment, we suggest you to choose Fidicus Homeopathy. At Fidicus Homeopathy, we have two kinds of consultation options. One is online consultation, the other one is offline. If you're someone who's staying nearby the nearest branch of Fidicus, you can come and contact us in person. But if you're someone who's staying away from us and you would like to get in touch with us, you can call us either to audio call, or you can connect us to the video call. After the doctor consultation has taken place, we will be asking you for investigations, and once the investigations are reviewed, especially to the online clients, we will be sending you our medication. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days, and if you're staying across the globe anywhere else, it can take 4 to 8 business days for our medicines to reach your doorstep. If you're someone who's experiencing PCOD or PCOS or any female reproductive organ diseases, you can contact us on this number. which is given here. You can call us, you can WhatsApp us, or you can message us on this number. And if you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's experiencing PCOD, PCOS, or any female reproductive organ diseases, try choosing Fidicus Homeopathy. Why is Fidicus Homeopathy much better option? We have seen how homeopathy is much better option than allopathy. Now we are going to tell you how Fidicus Homeopathy is much better option than any other homeopathic clinic. Because Fidicus Homeopathy stands for highest chance of health. Here we have already having good or high success rate with people who are suffering from PCOD, PCOS, endometriosis, adenomyosis, bulky uterus, and fibroids. Apart from that, we have transparent treatment, which is there is no gray area between the patient and the doctor. We will be clearly telling you about your prognosis. And the third thing, the personal care here at Fidicus is top notch. The reason why we are doing the video is because we are having a lot of patients who are asking a different questions. So we just thought, like, if the patient who is coming to us is asking these many questions, what if some people who are not expressing how they are feeling or what they have and do not even know if they're suffering from certain diseases. So we wanted to do educational videos on that. So we are doing these videos based on the personal experience we have had with our patients. So here at Fidicus, the personal care is top notch. Even if you're having some sort of queries or if you're having any sort of doubts, we will be clearing that to you. So if you want to choose health, if you want to choose proper cure for your diseases, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.